Ramesh is a 5-year-old shopkeeper. He feels tired most of the day, drinks water frequently, wakes up at night to pass urine, and notices that a small cut on his foot is not healing, even after many days. During a health camp, his blood sugar is checked and found to be very high. Ramesh is diagnosed with diabetes mellitus, global and Indian burden of diabetes. Today, diabetes affects more than 500 million people worldwide, and India has over 100 million people living with diabetes, making it a major public health problem. In this video, we will learn about what is diabetes, how it is diagnosed, types, signs and symptoms, who are at risk, medicine and insulin, diet, management, how to prevent complications. Also, myths related. What is diabetes mellitus? Diabetes mellitus is a chronic disease in which blood sugar levels remain high because the body does not produce enough insulin or cannot use insulin properly. Insulin is a hormone that helps sugar enter the cells to give energy. Types of diabetes. Type 1 diabetes occurs when the body stops producing insulin. Type 2 diabetes occurs when insulin is present but does not work effectively. Gestational diabetes occurs during pregnancy. Other rare types occur due to medicines or hormonal disorders. When we eat food, it is converted into sugar. Insulin works like a key, allowing sugar to enter the body's cells. In diabetes, the key, insulin, is missing, or the key does not work properly. So, sugar cannot enter the cells. Sugar stays in the blood. Blood sugar becomes high. Over time, this extra sugar damages eyes, kidneys, nerves, heart, and feet. People with diabetes may have frequent urination, excessive thirst, increased hunger, weight loss, tiredness, blurred vision, recurrent infections, and slow wound healing. Diabetes is diagnosed using blood tests. Fasting blood sugar, 8 hours fasting, is greater than or equal to 126 milligrams. DL, random blood sugar, is greater than or equal to 200 milligrams. DL with symptoms. HbA1c, 9.9%. OGTT, oral glucose tolerance test, measures how the body handles sugar after drinking a glucose solution. A 2-hour value is greater than or equal to 200 milligrams. DL confirms diabetes. What is type 1 juvenile diabetes? Type 1 diabetes is an autoimmune disease. The body destroys insulin-producing cells. It commonly occurs in children, teenagers, young adults. It requires lifelong insulin therapy. Common symptoms: frequent urination, excess thirst, weight loss, fatigue. It is not caused by lifestyle. Who are at risk for diabetes? Risk factors for type 2 diabetes: family history, obesity, sedentary lifestyle, age above 35 years, PCOS, history of gestational diabetes, high blood pressure, unhealthy diet. Common medications for diabetes and how to take them. Metformin. Metformin is usually the first medicine prescribed for type 2 diabetes. It reduces glucose production from the liver. How to take it. Take after food. Do not skip meals. It may cause mild stomach upset initially. Glympuride. This medicine increases insulin release from the pancreas. How to take it. Take before breakfast. Never skip meals. Watch for low blood sugar symptoms like sweating, dizziness, and shaky. Sitagliptin helps the body release insulin after meals. How to take it. Once daily, can be taken with or without food. Empagliflozin removes excess glucose through urine. How to take it. Once daily, drink adequate water. Maintain good hygiene to avoid urinary infections. Blood sugar can be checked at home using a glucometer by pricking the fingertip. Regular monitoring helps prevent complications. Insulin lowers blood sugar and cannot be taken orally because it gets destroyed in the stomach. It is given by injection using a syringe or pin. Injection sites include abdomen, thigh, upper arm, and buttocks, and sites must be rotated. Why diabetic foot care is important. High blood sugar damages, nerves reduce sensation, patient does not feel pain, blood vessels, poor circulation, poor immunity, increased infection risk. Because of this, even a small cut or blister can become a serious wound, leading to ulcers or amputation if ignored. Common foot problems in diabetes: loss of sensation or numbness, dry, cracked skin, corns and calluses, blisters and ulcers, fungal infection between toes, deformities of toes. Gangan in severe cases, daily foot care practices. People with diabetes should inspect feet daily, including soles and between toes. Use a mirror or ask family for help. Wash feet daily with lukewarm water. Dry feet well, especially between toes. Apply moisturizer to dry skin, but not between toes. Trim nails straight across. Wear clean cotton socks. Wear well-fitting, closed footwear. Check inside footwear before wearing. Never walk barefoot, even inside the house. Avoid using hot water bottles or heating pads. Avoid cutting corns or calluses at home. Avoid applying chemicals or strong antiseptics. Avoid ignoring minor wounds. Warning signs: seek medical help immediately for non-healing wounds, redness or swelling, pus or foul-smelling discharge, black or bluish discoloration of feet, fever with foot wound, sudden increase in pain or numbness. Acute complications and their symptoms. Hyperglycemia causes excessive thirst, frequent urination, fatigue, blurred vision, and dry skin. Hypoglycemia causes sweating, shaking, hunger, dizziness, headache, confusion, and loss of consciousness if untreated. Diabetic ketoacidosis causes very high blood sugar, nausea, vomiting, abdominal pain, fruity breath, deep breathing, confusion, and coma. Microvascular complications and symptoms: eye damage, retinopathy, blurred vision, floaters, vision loss. To prevent diabetic retinopathy, annual dilated eye examination, maintain good HbA1c control, control blood pressure, stop smoking, seek medical care if vision becomes blurry. Kidney damage, nephropathy, swelling of face and feet, frothy urine, reduced urine output, nerve damage, neuropathy, tingling, numbness, burning pain, loss of sensation, prevention of infections, and improving immunity. High blood sugar weakens immunity. Protect yourself by maintaining good sugar control, eating balanced diet rich in vegetables and protein, drinking adequate water, sleeping 7-8 hours daily, practicing hand hygiene, keeping vaccinations updated, treating minor wounds early, regular dental checkups. Dietary advice in diabetes: avoid excess sugar, sweets, fried foods, refined flour, and sugary drinks. Include whole grains, vegetables, pulses, lean protein, and healthy fats. Fruits like banana, mango, chiku, grapes, jackfruit, pineapple, and dry fruits should be restricted. Fruits like apple, guava, pear, orange, papaya, and berries are better choices in small portions. Meal planning and portion control help keep blood sugar within target range by spreading carbohydrates evenly across meals and preventing overeating. Using smaller plates, fixed meal timings, balanced portions of vegetables, whole grains, and proteins helps avoid sudden sugar spikes and hypoglycemia. Practical meal planning and portion control: eat at regular times. Fill 1/2 the plate with vegetables, 1/4 with protein, and 1/4 with whole grains, and avoid second helpings. Use a small plate, measure portions, 1 roti or 1/2 cup rice per meal. Limit sweets and include fruits only in small, planned serving. Potatoes have a high glycemic index and can raise blood sugar quickly, while sweet potatoes have a relatively lower glycemic index and are a better option. Both can be eaten in small portions. Alternative systems of medicine, Ayurveda, yoga, and naturopathy may support diabetes care. Fenugreek, bitter gourd, cinnamon, and gymnema may mildly reduce blood sugar. Yoga improves insulin sensitivity. These should be used only along with medical treatment. Exercises for people with diabetes. Exercise improves insulin sensitivity and reduces blood sugar. Recommended exercises: brisk, walking for 30 minutes daily, cycling, swimming, yoga, light, strength training 2-3 times per week, stretching exercises. Precautions: do not exercise on empty stomach if on insulin. Avoid exercise if sugar is above 250 milligrams. DL stop if feeling dizzy or weak. Myths about diabetes. Q and a format. Q. Can diabetes be cured permanently? A. No. Diabetes cannot be cured, but can be well controlled. Q. Should people with diabetes stop eating fruits? A. No. Fruits can be eaten in limited portions. Q. Is insulin addictive? A. No. Insulin is life-saving, not addictive. Q. Are honey and jaggery safe? A. No. They raise blood sugar like sugar. Q. Can herbal medicines replace tablets or insulin? A. No. They can only support treatment, not replace it. Closing message: diabetes is a lifelong condition, but with early detection, healthy lifestyle, proper medication, foot care, and regular monitoring, serious complications can be prevented and a healthy life can be lived.